Yesterday, I did something no African leader has done in modern history. I stood in front of the Burkinabé National Assembly and declared that Burkina Faso will no longer automatically accept WHO vaccine recommendations. We will independently test every vaccine before it enters our country. We will verify safety data ourselves. We will assess cost-benefit ratios based on our disease burden, not Western priorities. And we will refuse any vaccine that doesn't meet our standards regardless of WHO approval. The room erupted in applause, but in Geneva, at WHO headquarters, there was silence, complete silence. No press release, no condemnation, no response at all. And that silence tells you everything you need to know. My name is Ibrahim Traoré. I'm the president of Burkina Faso, and I'm about to tell you exactly why the WHO went silent when I declared pharmaceutical independence and what they're planning to do about it. But first, let me tell you what happened 48 hours before my declaration that made this inevitable. 2 days before my speech, my health minister delivered a 300-page report to my office. The cover simply said, Vaccine Procurement Analysis, 2019 to 2024. I expected a boring bureaucratic document. What I got was evidence of the most systematic exploitation of African countries I've ever seen documented. The report analyzed every vaccine Burkina Faso had purchased in the past 5 years. Our scientists had done something radical. They'd actually investigated what we were buying. They traced manufacturing costs. They analyzed profit margins. They compared what we paid versus what the same vaccines cost in Western countries. They looked at which vaccines were actually necessary for our disease profile versus which ones we were told to buy. Page after page of documented exploitation. Let me give you just 3 examples from that report because these 3 examples alone justified everything I said in my declaration. Burkina Faso was paying $8.50 per dose for a rotavirus vaccine. We were told this was a discounted price for low-income countries. We were told we should be grateful. Our scientists investigated the actual manufacturing cost, $0.90 per dose. We were paying almost 10 times the production cost. But it gets worse. They analyzed our disease burden data. Rotavirus causes diarrheal disease, serious, sometimes fatal, especially in children. But in Burkina Faso, most diarrheal deaths aren't from rotavirus. They're from contaminated water and poor sanitation. The rotavirus vaccine was reducing deaths by maybe 5%. Clean water would reduce them by 70%. We'd spent $42 million on rotavirus vaccines over 5 years. That same money could have built water systems for 200 villages. We could have prevented far more deaths for far less money. But WHO recommendations prioritize the vaccine. Why? Because pharmaceutical companies profit from vaccines. Nobody profits from clean water infrastructure. When our scientists calculated the cost per life saved, the numbers were staggering. The rotavirus vaccine cost approximately $84,000 per life saved in Burkina Faso. Clean water infrastructure, $1,200 per life saved. That's a 7-0-1 difference. For every life saved by rotavirus vaccines, we could have saved 70 lives with water infrastructure for the same money. But the WHO doesn't have a water infrastructure initiative. They have vaccine programs. Because Nestle and Coca-Cola don't fund the WHO, pharmaceutical companies do. We were buying HPV vaccines for $4.50 per dose, 3 doses required per person. That's $13.50 per girl to vaccinate against cervical cancer. Our scientists checked. The manufacturing cost is $0.60 per dose. We were paying 7.5 times the production cost. But they also analyzed our cancer mortality data. Cervical cancer kills about 400 Burkinabé women per year. Terrible, yes. But malaria kills 4,000. Respiratory infections kill 3,500. Malnutrition-related diseases kill 6,000. We were spending millions on a vaccine for a disease that causes 2% of our female mortality, while diseases causing 60% of mortality were underfunded. Why? Because WHO guidelines pushed HPV vaccination as a priority. And WHO's largest funders are pharmaceutical companies and Western governments with pharmaceutical interests. Our scientists went further. They calculated what would happen if we reallocated the HPV vaccine budget to malaria prevention. The numbers were shocking. The $6.8 million we spent on HPV vaccines over 3 years could have purchased 2 million mosquito nets. Those nets would have prevented an estimated 3,400 malaria deaths. The HPV vaccines we bought will prevent an estimated 120 cervical cancer deaths over the next 30 years. 3,400 lives versus 120 lives. Same money, different priorities. But malaria prevention doesn't generate pharmaceutical profits. HPV vaccines do. And somehow, the WHO's priorities always align with pharmaceutical profits. This one made me furious. We were paying $9 per dose for pneumococcal vaccine. Manufacturing cost, $1.20 per dose. But here's what really matters. The pneumococcal vaccine protects against certain strains of bacteria that cause pneumonia. But the strains prevalent in Burkina Faso are different from the strains prevalent in Western countries. The vaccine we were buying was designed for Western disease patterns. It was maybe 40% effective against the strains actually killing Burkinabé children. A different vaccine formulation, one designed for African bacterial strains, would be 80% effective. But that vaccine doesn't exist because pharmaceutical companies design for profitable Western markets, not for African disease patterns. So we were paying massive markups for a vaccine that was only half as effective as it could be because nobody bothered to make a version that actually worked for us. Our scientists documented this in detail. They sequenced the bacterial strains causing pneumonia deaths in Burkina Faso. They compared them to the strains covered by the vaccine we were buying. The mismatch was undeniable. Then they calculated, if we had a vaccine designed for our bacterial strains, at the same price, we could prevent twice as many deaths. If we had a vaccine designed for our strains at fair pricing, we could vaccinate twice as many children and prevent 4 times as many deaths. But pharmaceutical companies won't develop African-specific vaccines because African markets aren't profitable enough at fair prices. They're only profitable at exploitative prices. And exploitative prices mean most African children don't get vaccinated at all. So they design vaccines for Western markets, sell them to Africa at inflated prices, and call it global health cooperation. These 3 examples represent billions of dollars extracted from Africa annually. Multiply this across every vaccine, every African country, every year. That's what my declaration was about. Not rejecting vaccines, rejecting exploitation disguised as public health. But the report didn't stop with 3 examples. It documented patterns across every vaccine program. Pattern 1, price discrimination. The same vaccines cost different prices in different markets, not based on shipping costs or local expenses, based on what pharmaceutical companies think they can extract. A measles vaccine costs $0.25 in India, $0.85 in Europe, $2.10 in Burkina Faso. Same vaccine, same manufacturer, different prices, because they know we have no alternatives. Pattern 2, package deals. Pharmaceutical companies bundle vaccines. You can't buy just the vaccines you need. You have to buy packages that include vaccines you don't need. We needed yellow fever vaccines. But the supplier wouldn't sell us yellow fever vaccines alone. We had to buy a package that included hepatitis B vaccines, even though Burkina Faso has low hepatitis B prevalence. Why? Because they have excess hepatitis B vaccine inventory, so they force African countries to buy it whether we need it or not. We calculated we spent $8.2 million over 3 years on vaccines we didn't need, bundled with vaccines we did need. Pattern 3, expiration dates. Vaccines close to expiration are dumped on African markets at discount prices. We're told we should be grateful for the generosity. But vaccines near expiration are logistically problematic. We have to rush distribution. We have to prioritize expiring vaccines over optimal scheduling. We waste significant quantities because we can't distribute fast enough. Our scientists calculated that 23% of near-expiration vaccines we purchased ended up wasted. We paid for them. They counted against our procurement budget, but they never protected anyone. When we complained to suppliers, they said, "You're getting discounted prices. If you want longer shelf life, pay full price." But even the full price is already marked up 500 to 800% over manufacturing cost. We're being charged exploitative prices for vaccines that are about to expire, and then blamed for waste when we can't distribute them in time. Pattern 4, unnecessary boosters. WHO recommendations include booster shots for certain vaccines, but our scientists found the evidence for these boosters is weak, at least for our disease environment. For some vaccines, antibody levels remain protective for decades without boosters. But WHO recommends boosters anyway. Why? Because every booster is another sale for pharmaceutical companies. We calculated we spent $12 million over 3 years on booster doses that provided minimal additional protection. That money could have purchased first doses for unvaccinated children, actual life-saving interventions instead of redundant boosters. Pattern 5. Cold chain requirements. Some vaccines require expensive cold chain logistics, constant refrigeration from manufacture to administration. This is necessary for vaccine stability. But some vaccines are formulated to require cold chain when thermostable versions exist. Thermostable vaccines don't need continuous refrigeration. They're easier to distribute in hot climates. They waste less. They're more practical for Africa. But thermostable versions are often more expensive or unavailable. Why? Because pharmaceutical companies profit from selling both vaccines and cold chain equipment. If you need refrigerators, trucks with refrigeration, cold storage facilities, they sell all of that too. Or their partners do, and they get a cut. We spent $18 million over 3 years maintaining cold chain infrastructure. Much of that could have been avoided with thermostable vaccine formulations that exist but aren't made available to African markets. These patterns repeat across every vaccine program. Everywhere we looked, we found exploitation, price discrimination, forced bundling, expiration date dumping, unnecessary boosters, expensive logistics when alternatives exist. And the WHO enables all of it with their recommendations. Let me tell you exactly what I said in my declaration, because Western media is already distorting it. I stood before the National Assembly and said, Burkina Faso declares pharmaceutical sovereignty. Effective immediately, we will no longer automatically accept WHO vaccine recommendations. Every vaccine will be independently tested in Burkinabé laboratories before approval. Every vaccine will be assessed based on Burkinabé disease priorities, not Western guidelines. Every vaccine price will be evaluated against actual manufacturing costs, and we will refuse to pay exploitative markups. I continued, this is not anti-vaccine. This is pro-African health. We are not rejecting medical science. We are rejecting medical colonialism. We are not endangering our people. We are protecting them from a system that profits from their suffering. Then I said the part that made the WHO go silent. I call on the WHO to publish the manufacturing costs of every vaccine they recommend. I call on them to explain why vaccines cost 10 times more in Africa than they cost to produce. I call on them to justify why their recommendations prioritize pharmaceutical profits over African lives, and until they do, Burkina Faso will make our own decisions about what our people need. The chamber exploded in applause. Legislators were standing, cheering. Some were crying. Because every African leader knows this is true. They've all seen the exploitation. They've all watched their health budgets drain into Western pharmaceutical company profits while their people die from preventable diseases. But I'm the first one who said it out loud. I'm the first one who demanded accountability. I'm the first one who actually did something about it. And that's why the WHO went silent. The WHO's silence wasn't weakness. It was calculation. They couldn't respond because any response would require them to answer my questions. And they can't answer those questions without exposing the corruption at the heart of global health. Think about it. If the WHO condemned me, I'd ask them to publish manufacturing costs. They can't do that because it would expose the price gouging. If they defended current prices, I'd ask them to explain why African countries pay more than Western countries for the same vaccines. They can't explain that without admitting exploitation. If they claimed vaccines are priced fairly, I'd release our 300-page report documenting the actual costs versus the prices we pay. They can't dispute documented evidence. If they argued WHO recommendations are unbiased, I'd point out that their largest funders are pharmaceutical companies and Western governments. They can't deny their conflicts of interest. Every possible response makes things worse for them. So, they chose silence. But that silence is its own response. It's an admission that they have no good answers. Within hours of my speech, I started receiving communications, not public statements, private messages. 6 hours after my declaration, my foreign minister received a call from the U.S. Embassy. They wanted an urgent meeting to discuss concerning developments in Burkina Faso's health policy. We took the meeting. The American diplomat was direct. President Traoré's statements about vaccines are dangerous. They undermine global health cooperation. They could trigger vaccine hesitancy across Africa. The The United States strongly urges Burkina Faso to reconsider this position. My foreign minister asked, which part is factually incorrect? Are the manufacturing costs wrong? Are the prices wrong? Are the disease burden assessments wrong? The diplomat didn't answer. Instead, this isn't about facts. It's about the message. Anti-vaccine rhetoric is dangerous regardless of the economic arguments. My minister responded, we're not anti-vaccine, we're anti-exploitation. If you believe we're wrong about the costs, prove it. Publish the actual manufacturing costs and profit margins. The meeting ended badly. The American diplomat made thinly veiled threats about aid cuts and diplomatic consequences. But here's what's interesting. The American diplomat couldn't dispute a single fact we presented. Not one. He didn't say our manufacturing cost data was wrong. He didn't say our disease burden analysis was flawed. He didn't say our cost-effectiveness calculations were incorrect. He just said talking about it was dangerous. That tells you everything. They can't defend the system on merits, so they attack anyone who questions it. 12 hours after my speech, the French ambassador requested a meeting. Same message, different accent. France is deeply concerned about Burkina Faso's rejection of international health cooperation. This could have serious consequences for our bilateral relationship. My foreign minister asked, are you denying that French pharmaceutical companies profit massively from African vaccine markets? No answer. Are you denying that these companies charge prices far above manufacturing costs? No answer. Then what exactly is France concerned about? African health or French pharmaceutical profits? That meeting also ended badly. But again, notice, the French ambassador didn't dispute our facts, he just threatened consequences. 24 hours after my speech, the British High Commission sent a formal diplomatic note expressing alarm at Burkina Faso's departure from evidence-based medicine. We sent a note back. Please provide evidence that vaccines designed for Western disease patterns are equally effective for African disease patterns. Please provide evidence that current prices reflect fair value rather than exploitative markups. We await your evidence for evidence-based medicine. No response. The pattern was clear. Western governments were coordinating a response, but they couldn't respond publicly because they had no good arguments, so they were applying private pressure. 36 hours after my declaration, I received a call, not from the WHO Director General, that would be too official, from a WHO senior advisor. The conversation was remarkable because of what wasn't said. The advisor opened, Mr. President, the WHO is concerned about misunderstandings regarding our vaccine recommendations. I said, I understand perfectly. You recommend vaccines that cost 10 times their manufacturing cost. You prioritize diseases that affect Western countries over diseases that kill millions of Africans. You accept funding from pharmaceutical companies and then recommend their products. What am I misunderstanding? Long pause. Then, the situation is more complex than that. I said, then explain the complexity. Explain why we pay $9 for a vaccine that costs $1.20 to manufacture. Explain why we're told HPV vaccines are a priority when malaria kills 10 times more Burkinabé women. Explain the complexity. Another pause. There are multiple factors in vaccine pricing, research and development costs, distribution, cold chain, regulatory compliance. I interrupted. We've calculated all of that. Even with generous estimates for R&D amortization, distribution, and regulatory costs, fair pricing would be manufacturing cost plus 40–50%. We're paying 500 to 800% markups. Explain that. Silence. Then, Mr. President, we're concerned this rhetoric could fuel vaccine hesitancy. Even if there are legitimate discussions to be had about pricing, the public health cost of undermining confidence in vaccines is too high. This is their go-to argument. Don't question anything because questioning might reduce vaccine uptake. I said, so Africans should just accept exploitation silently? We should pay whatever prices pharmaceutical companies demand because asking questions might cause hesitancy? Is that the WHO's position? That's not what I'm saying. Then what are you saying? Because from here, it sounds like you're saying African countries should shut up and pay whatever we're charged, regardless of whether prices are fair, because questioning exploitation is dangerous. The call ended shortly after. Cordial, but tense. But here's what matters. The WHO didn't dispute our data. They didn't challenge our calculations. They didn't defend vaccine pricing. They just said questioning it publicly was dangerous. That's not a health argument, that's a political argument. And it proves my point. This isn't about health, it's about protecting a profitable system from scrutiny. While the WHO stayed publicly silent, they weren't inactive. Through our intelligence sources, we learned that WHO officials were holding emergency meetings with pharmaceutical company representatives. The topic, responding to the Burkina Faso challenge. They weren't discussing how to address my concerns, they were discussing how to neutralize me. We obtained notes from one of these meetings. Let me read you some excerpts. Traoré's demands for cost transparency cannot be met. Publishing manufacturing costs would trigger demands for price reductions across all markets. This is unacceptable. Who cannot be seen as defending pharmaceutical profits over African health? Any public response must frame Traoré as anti-vaccine rather than anti-price gouging. Recommended approach: coordinate with African governments to isolate Burkina Faso. Position this as rejection of science rather than rejection of exploitation. Use media to associate Traoré with vaccine hesitancy movements. This is their strategy. They can't defend the substance of what I'm saying, so they'll attack the messenger. They'll call me anti-science, anti-vaccine, dangerous. They'll try to make this about vaccine rejection instead of pharmaceutical exploitation. But I have documentation, I have evidence, I have manufacturing costs and profit margins and disease burden data, and I'm going to release all of it. The meeting notes also included this: particular concern about Traoré's proposal to share cost analysis with other African leaders. If multiple countries adopt similar positions, the African vaccine market becomes untenable at current pricing. Untenable at current pricing, not untenable for public health, untenable for profits. They're not worried about African health outcomes, they're worried about African countries paying less for vaccines. That's what this is actually about. 3 days after my declaration, I held a press conference. I brought the 300-page report. I stood in front of international media and said, "The WHO says I'm undermining global health. Let me show you what global health actually looks like in Burkina Faso." I displayed charts showing manufacturing costs versus prices we pay. The markups were undeniable. I showed disease burden data compared to vaccine priorities. The misalignment was obvious. I presented analyses of vaccine effectiveness for African versus Western disease patterns. The disparities were documented. Then I did something unprecedented. I released the full 300-page report online. Anyone could download it. Anyone could verify our data. Anyone could check our calculations. I said, I'm not hiding behind closed doors. I'm not making unsubstantiated claims. Here's the evidence. Check it yourselves. Verify it. Find errors if you can. This is what transparency looks like. Then I made an offer. I will debate any WHO official, any pharmaceutical company representative, any Western health minister on live television. Bring your data. I'll bring mine. Let the world see who's actually following the evidence. No one accepted, because they know they can't win on facts. Western media coverage was predictable. Headlines: African leader rejects WHO vaccines. Burkina Faso president embraces vaccine skepticism. Traoré puts children at risk with anti-vaccine stance. Not one mainstream Western outlet accurately reported what I actually said. Not one mentioned the price gouging. Not one discussed the evidence I presented. CNN ran a segment with a global health expert who said I was dangerously undermining vaccine confidence in Africa. They didn't mention vaccine prices. They didn't mention our cost analysis. They just called me dangerous. BBC interviewed a pharmaceutical industry representative who said, vaccine pricing reflects the enormous costs of research, development, and ensuring safety. These are complex products that require significant investment. Nobody asked him why the same vaccine costs 3 times more in Burkina Faso than in Europe if costs are the same. Nobody asked him to justify specific price points. They just let him speak in generalities while painting me as reckless. The New York Times ran an op-ed titled, "The Dangers of Vaccine Nationalism in Africa." It barely mentioned price. It focused entirely on the risks of countries going it alone on vaccine policy. But African media covered it differently. They showed the charts. They discussed the markups. They asked why African countries pay so much more than drugs cost to produce. The Daily Nation in Kenya ran a headline, "Do Kenyans pay too much for vaccines?" Burkina Faso's analysis raises questions. They interviewed Kenyan health economists who found similar patterns in Kenya's vaccine procurement. South Africa's Mail and Guardian published our full report with analysis from South African pharmaceutical researchers. They found comparable exploitation in South African vaccine markets. Nigeria's Punch newspaper investigated vaccine pricing in Nigeria. They found markups of 600 to 900% over manufacturing costs. African media was actually doing journalism. Western media was doing public relations for pharmaceutical companies. And African social media exploded. Young Africans were sharing the data, discussing the exploitation, asking why their governments accept these prices. Within a week, vaccine transparency was trending across African Twitter. Millions of Africans were reading our report, verifying our data, and demanding answers from their governments. That's what the WHO feared most, not one African leader questioning vaccine prices. 50 million young Africans seeing documented evidence of exploitation and demanding change. Within a week of my declaration, pharmaceutical company stock prices started moving. GSK dropped 3%, Pfizer dropped 2.5%, Moderna dropped 4%. Why? Because investors understood what analysts were writing in financial reports. If Burkina Faso successfully implements independent testing and price negotiations, other African countries will follow. African vaccine markets represent $8.12 billion annually. Price reductions of 50–70% would cost the industry $4.8 billion per year. That's real money. That's why they're panicking. But it's not just about African markets. Analysts also wrote, precedent of cost transparency in African markets could trigger demands for similar transparency in other markets. If manufacturing costs become public knowledge, pricing power across all markets is threatened. That's the real fear, not losing African markets, losing pricing power globally. Because if Africans can see that vaccines cost $1 to make and sell for $9, why can't Americans ask why they pay $180 for the same vaccine? Pharmaceutical companies started lobbying Western governments intensively. They wanted sanctions against Burkina Faso. They wanted aid cuts. They wanted diplomatic isolation. They wanted regime change if necessary. One pharmaceutical lobbyist was quoted anonymously in the Financial Times, "We can't let this stand." If African countries start independently verifying and price negotiating, it sets a precedent for other markets. This isn't just about Burkina Faso. This is about protecting pricing power globally. They said the quiet part out loud. This isn't about health. It's about profit. An internal memo from GSK that was leaked to us stated, the Burkina Faso situation must be contained. If their approach spreads, African markets become unprofitable at scale. More critically, cost transparency threatens our pricing strategies in developed markets. Recommend coordinating with WHO and major funders to isolate Burkina Faso and prevent precedent from establishing. Another leaked document from Pfizer's government affairs team outlined a strategy: engage U.S. State Department to apply diplomatic pressure. Coordinate with European governments to threaten aid reductions. Work with WHO to frame this as public health threat rather than pricing dispute. Prepare media strategy to associate Traoré with anti-vaccine movement. These aren't conspiracy theories. These are documented strategies from leaked internal communications. Pharmaceutical companies are actively coordinating to crush our independence movement. While the WHO stayed silent and pharmaceutical companies lobbied for sanctions, we were building. I announced the Burkinabé Pharmaceutical Verification Agency, an independent body that will test every vaccine and drug before it's approved for use in Burkina Faso. We're recruiting scientists, not just Burkinabé scientists. We're recruiting from across Africa. We're offering competitive salaries. We're building state-of-the-art laboratories. We're creating the scientific infrastructure to actually verify what pharmaceutical companies claim. We're establishing testing protocols based on international scientific standards, not based on WHO recommendations that prioritize Western interests. We're using the same protocols European and American regulatory agencies use, but we're applying them ourselves for our interests. We're partnering with Cuba, which has decades of experience in independent pharmaceutical development. Cuban scientists are helping us design testing systems. Cuban doctors are training our researchers. Cuba has offered to send 50 pharmaceutical scientists for 2-year rotations to help establish our capacity. We're working with China to build pharmaceutical manufacturing capacity, not to import Chinese vaccines instead of Western vaccines, to manufacture our own vaccines designed for African disease patterns. China is funding construction of 3 pharmaceutical manufacturing facilities in Ouagadougou. These facilities will be capable of producing vaccines, antibiotics, and essential medicines. Chinese firms are providing equipment. Chinese engineers are training Burkinabé operators, but the facilities will be owned by Burkina Faso, operated by Burkina Faso, for Burkinabé interests. We're coordinating with Algeria, which already manufactures 70% of its own pharmaceuticals. They're sharing technical expertise and manufacturing protocols. Algerian pharmaceutical engineers are consulting on our facility designs. Algerian regulators are helping us establish quality control systems. We're establishing a vaccine pricing database that will publish the actual manufacturing cost of every vaccine alongside the prices African countries pay. We're making the exploitation visible to everyone. The database will be open source. Any African country can access it. Any researcher can verify our data. Any journalist can investigate their own country's vaccine procurement. We're inviting other African countries to join us, not to reject vaccines, to reject exploitation. Tanzania has already expressed interest. Their health minister visited Ouagadougou last week. We shared our analysis. They're conducting their own review of vaccine procurement. Early findings: similar patterns of exploitation. Zimbabwe sent a delegation. They're considering establishing their own pharmaceutical verification capacity using our model. Uganda reached out quietly. They can't publicly support us yet. They're too dependent on Western aid. But they're watching. They're interested. They're calculating. Here's something Western media won't tell you. I made an offer to pharmaceutical companies. A fair offer. An offer they refused. I said publicly, we're willing to pay fair prices for vaccines. Manufacturing cost plus 20% profit margin plus distribution costs. Show us the real costs, and we'll pay fair value. A 20% profit margin is reasonable. It's more than most industries make. Apple's profit margin is 15%. Amazon's is 6%. Even luxury goods companies average 15-20% profit margins. But it's not the 800% margins they're currently extracting from Africa. I said, provide documentation of manufacturing costs. Provide documentation of distribution costs. Provide documentation of R&D costs that need to be amortized. We'll verify it independently, and we'll pay fair value based on verified costs. Not one company accepted. Pfizer released a statement saying, vaccine pricing is complex and reflects multiple factors, including research, investment, regulatory compliance, and public health value. We don't disclose proprietary manufacturing information. Translation: we won't tell you what vaccines actually cost, because then you'll know we're overcharging. GSK said, we offer tiered pricing to ensure vaccines reach populations in need. Our prices reflect the value vaccines provide. Translation: we charge different prices in different markets based on what we think we can extract, and we won't justify those prices. Moderna said, we're committed to global vaccine access. Our pricing strategies balance sustainability with accessibility. Translation: we want to maintain high prices while sounding concerned about access. Not one company addressed my actual offer. Not one provided cost documentation. Not one agreed to transparent pricing. Because they can't. Because if they show us the real costs, every African country will demand the same fair pricing, and their entire business model collapses. So instead, they're lobbying for sanctions. They're spreading misinformation about my positions. They're trying to isolate Burkina Faso, because it's easier to destroy one African leader than to justify exploitative prices to a billion Africans. Something interesting happened after my declaration. African doctors started speaking up. A group of 50 Burkinabé doctors signed a public letter supporting my position. They wrote, as medical professionals, we support President Traoré's declaration. We are not anti-vaccine. We administer vaccines daily. But we have watched for years as our health budgets are consumed by overpriced pharmaceuticals, while basic health infrastructure remains underfunded. Independent verification and fair pricing are not anti-science, they are good governance. Then doctors from other African countries started signing on. Within 2 weeks, over 500 African doctors had signed the letter. These aren't fringe anti-vaxxers. These are practicing physicians, public health officials, medical researchers, people who believe in vaccines but also believe Africa shouldn't be exploited. Dr. Amina Conte, a Ghanaian epidemiologist, wrote, I've spent my career promoting vaccination. I believe in vaccines, but I also believe in fair pricing. These positions aren't contradictory. Questioning pharmaceutical exploitation isn't anti-science, it's pro-justice. Dr. James Amondi, a Kenyan pediatrician, wrote, "I vaccinate children every day. I've seen vaccines save lives. I've also seen families unable to afford medicine while pharmaceutical companies report record profits. We can support vaccines and oppose exploitation simultaneously." Dr. Fatima Diallo, a Senegalese public health researcher, wrote, "The scientific evidence for vaccines is strong. The moral case for fair pricing is also strong. These aren't competing values. They're complementary. We can have both effective vaccines and fair prices." The WHO couldn't dismiss them as anti-science, so they ignored them instead. But a doctors' movement was forming. Medical professionals across Africa were publicly supporting pharmaceutical sovereignty. The African Medical Association invited me to speak at their annual conference. I accepted. I presented our full analysis. I answered questions from doctors and researchers. Not one doctor disputed our cost data. Not one challenged our disease burden analysis. Not one defended current vaccine pricing. Instead, doctor after doctor stood up and shared similar stories from their countries. Exploitative pricing, misaligned priorities, vaccines designed for Western disease patterns being pushed on African populations. A Nigerian doctor showed procurement data from Nigeria that mirrored our findings. An Ethiopian doctor presented similar analysis from Ethiopia. A Ugandan doctor shared vaccine effectiveness studies showing the same pattern: vaccines designed for Western bacterial and viral strains being less effective in African contexts. The conference passed a resolution. The African Medical Association supports independent pharmaceutical verification and fair pricing across Africa. We call on African governments to prioritize disease burden data over external recommendations when making procurement decisions. That resolution was signed by medical associations from 34 African countries, thousands of doctors, public health officials, medical researchers. The WHO still stayed silent, but the medical community was speaking loudly. While Western governments and the WHO stayed publicly silent or applied private pressure, other countries started responding publicly. Bolivia's health minister released a statement. Bolivia supports Burkina Faso's right to independent pharmaceutical verification. We face similar challenges with drug pricing and will be watching Burkina Faso's approach with interest. Venezuela announced they would send pharmaceutical experts to Burkina Faso to share their experience manufacturing vaccines independently under sanctions. Venezuela's experience is valuable because they've been doing exactly what we're attempting, building pharmaceutical independence while under Western sanctions. They manufacture their own vaccines. They've developed their own supply chains. They've learned how to operate outside Western-controlled systems. Their health minister told me on a call, "We were forced into independence by sanctions. You're choosing it proactively. That's wise. We wasted years hoping Western companies would treat us fairly. They won't. Build your own capacity now." Cuba publicly offered to help establish the Pharmaceutical Verification Agency and train Burkinabé scientists. Cuba's offer is extraordinary because of their track record. Cuba manufactures 5 vaccines domestically, including a COVID vaccine that proved more effective than many Western vaccines. They did this while under comprehensive U.S. sanctions that blocked access to equipment, raw materials, and technology. If Cuba can develop vaccines under those conditions, African countries certainly can. We have more resources, more population, more market size. We just need political will. Cuba's director of biopharmaceuticals spoke at a press conference. Cuba stands ready to share everything we've learned about pharmaceutical independence. We will train African scientists in Havana. We will send Cuban experts to Africa. We will share our manufacturing protocols, because we believe health is a human right, not a profit center. Iran announced they would share their pharmaceutical manufacturing technology with Burkina Faso and offer preferential pricing for any medicines we still need to import during our transition to self-sufficiency. Iran's experience is perhaps the most relevant to our situation. They've been under sanctions for over 40 years. They've been told repeatedly that they can't develop their own pharmaceuticals, that they lack the capacity, that they need Western companies. They proved everyone wrong. Iran now manufactures over 95% of its medicines domestically. They produce vaccines, antibiotics, cancer treatments, everything. All while under sanctions designed to prevent exactly that. Iran's deputy health minister told me, "The sanctions were meant to make us dependent. They had the opposite effect. They forced us to become self-sufficient. Burkina Faso has the opportunity to build that self-sufficiency without waiting for sanctions. Do it now. China stated, China respects every nation's right to make independent decisions about healthcare policy. We support Burkina Faso's efforts to build pharmaceutical capacity. But China's statement was backed by action. Within days, Chinese pharmaceutical companies reached out with concrete offers, not to sell us vaccines at high prices, to help us build manufacturing capacity. One Chinese firm offered to build a vaccine production facility in Ouagadougou at cost no markup, no profit. They said, we'll build it, train your people, and transfer full ownership. You pay only for materials and labor. We're not trying to profit from this. We're trying to demonstrate that pharmaceutical independence is achievable. Another Chinese company offered to share vaccine formulas that aren't patent protected. They said, these are proven vaccines. We'll show you how to manufacture them. No licensing fees, no royalties, just technology transfer. This is what partnership looks like when the partner isn't trying to maintain your dependence. Russia said, Russia recognizes the importance of pharmaceutical sovereignty and is willing to cooperate with Burkina Faso on medical technology transfer. Russia offered access to their Gamaleya Institute, the research center that developed the Sputnik V vaccine. They invited Burkinabé scientists to train there. They offered to share manufacturing protocols for vaccines Russia produces domestically. A coalition was forming, not against vaccines, against pharmaceutical exploitation. And notably, several African countries quietly reached out asking for information about our approach. They couldn't publicly support us, yet they're too dependent on Western aid. But they were interested. They were watching. They were calculating whether they could do the same thing. What I haven't told you yet is what happened behind closed doors with other African leaders. 2 weeks after my declaration, I started receiving calls, private calls, encrypted communications, African presidents and health ministers reaching out to ask questions. One West African president called me and said, what you're doing is what we all want to do. But we're afraid. Our economies depend on Western aid. If we follow your path, they'll cut us off. How do you plan to survive that? I told him, we're building alternative partnerships before the pressure intensifies. China, Russia, Cuba, Iran, they're offering to fill the gaps the West will create. And more importantly, pharmaceutical independence will save us more money than we'll lose in aid cuts. The math actually works. I shared our calculations. Burkina Faso receives approximately $400 million annually in Western aid. About 15% of that is health aid, $60 million. If we achieve pharmaceutical independence and reduce our drug costs by 60%, we save $180 million annually on pharmaceuticals alone. Even if the West cuts all health aid, we come out ahead, and that's before counting savings from prioritizing high-impact interventions instead of following WHO recommendations that serve pharmaceutical interests. The president said, I want our health ministry to analyze this. If the math works, we might follow. Another African leader sent a health delegation to visit us quietly. No public announcement, no media coverage. They spent a week reviewing our analysis, meeting our scientists, examining our evidence. When they left, their delegation leader told me, everything you've documented is consistent with what we've found in our own procurement. We've been afraid to say it publicly. But you're right. We're being exploited. And we're considering what to do about it. A third African country, I won't name them, sent their pharmaceutical regulators to train with our team. They're learning our verification protocols. They're planning to implement similar systems. They just can't announce it yet because they're negotiating aid agreements with Western donors and don't want to jeopardize those negotiations. But they're preparing, and when their aid agreements are secured, they'll move toward pharmaceutical independence. This is happening across Africa. Leaders are watching, they're calculating, they're preparing. Even if they can't support us publicly, they're moving in the same direction privately. Now, 3 weeks after my declaration, the WHO still hasn't issued a public response. But their silence is strategic. They're waiting to see if I fail. They're hoping Western pressure will force me to back down. They're banking on economic sanctions, making pharmaceutical independence unsustainable. If I fail, they never have to respond. My declaration becomes a cautionary tale. Other African leaders learn, don't challenge the system. But if I succeed, if we build independent testing capacity, if we manufacture our own vaccines, if we prove pharmaceutical sovereignty is viable, then they'll have to respond. And they'll have to answer the questions they're currently avoiding. That's why they're silent. They're hoping silence outlasts my resistance. But their silence is also strategic for another reason. They don't want to give this more publicity. Every time they respond, more people learn about pharmaceutical pricing exploitation. More people start asking questions. More people demand transparency. Silence is their way of trying to starve this movement of oxygen. If they don't talk about it, maybe it won't spread. But it's already spreading. African social media is full of discussions about vaccine pricing. African journalists are investigating pharmaceutical procurement in their own countries. African doctors are demanding changes. The silence isn't working. It's just exposing the WHO's unwillingness to defend their own recommendations. Let me be absolutely clear about what I'm doing, because there's deliberate confusion being spread. I am not anti-vaccine. I believe vaccines save lives. I want Burkinabé children vaccinated against deadly diseases. I am anti-exploitation. I refuse to pay 800% markups on vaccines that cost cents to produce. I refuse to prioritize Western pharmaceutical profits over Burkinabé health outcomes. I am not rejecting science. I'm demanding science. Real science. Which means independently verifying what we're told, instead of blindly accepting it. I am not endangering my people. I'm protecting them. From a system that views African lives as profit centers rather than human beings deserving quality health care at fair prices. This isn't radical. This is basic governance. Any responsible leader should verify what they're buying and refuse to pay exploitative prices. The fact that this is controversial tells you how deeply captured global health institutions are by pharmaceutical interests. Let me give you a comparison. If I said Burkina Faso would independently test roads before accepting them from contractors, nobody would call me anti-infrastructure. If I said we'd verify the quality of imported food before distributing it, nobody would call me anti-nutrition. If I said we'd assess the cost-effectiveness of different education programs before implementing them, nobody would call me anti-education. But when I say we'll independently test vaccines and verify their prices are fair, suddenly I'm anti-vaccine? That's absurd. The difference is that there's no powerful global road contractor lobby, no massive food cartel, no international education corporation worth hundreds of billions. But there is a pharmaceutical industry that profits enormously from African dependence and unquestioning acceptance of their products at their prices. That's why this is controversial. Not because it's radical. Because it threatens profits. I know what's coming. The WHO's silence is temporary. Western governments are coordinating sanctions. Pharmaceutical companies are lobbying for my removal. Intelligence agencies are likely funding opposition groups. They will try everything to stop this. Because if Burkina Faso succeeds, the entire system of pharmaceutical exploitation in Africa collapses. I've received intelligence reports about what's being planned. I won't share all the details. Some information needs to remain confidential for security reasons. But I can tell you this: the pressure will be economic, diplomatic, and potentially military. Economic pressure. The IMF has already indicated they're reviewing Burkina Faso's loan programs. The World Bank has delayed several scheduled disbursements pending policy assessments. European donors are reconsidering aid commitments. This is the standard playbook. Cut financial flows, create economic pressure, make the population suffer, blame the government, create conditions for political instability. But we're prepared. We've been building foreign currency reserves. We've been diversifying our trade relationships. We've been preparing for aid cuts by identifying which programs we can maintain with alternative funding and which we'll need to temporarily suspend. We've also been realistic with our population. I've told Burkinabé citizens, aid cuts are coming. Times will be hard, but we're not being punished for doing something wrong. We're being punished for refusing to be exploited. And if we endure this pressure, we'll come out stronger and truly independent. Diplomatic pressure. Western embassies are already reducing their staff in Ouagadougou. They're issuing travel warnings about Burkina Faso. They're spreading rumors about instability and danger. This is designed to isolate us, to make investors nervous, to discourage trade and tourism, to create the impression that Burkina Faso is failing. But we're countering this with our own diplomatic outreach. We're strengthening relationships with non-Western countries. We're hosting trade delegations from China, Russia, and Middle Eastern countries. We're showing that we're not isolated, we're diversifying. Military pressure. This is the most concerning. I've received credible intelligence that Western intelligence agencies are making contact with opposition figures. They're likely funding groups that could create internal instability. This is the regime change playbook. Economic pressure creates grievances. Intelligence agencies fund and organize opposition. Media frames the resulting instability as government failure. International community calls for intervention. I've seen it happen in Libya. I've watched it unfold in multiple African countries. I know what's coming. But I'm prepared. I've purged security forces of Western-trained officers who might be vulnerable to recruitment. I've strengthened presidential security. I've built relationships with intelligence services from countries that have successfully resisted Western regime change attempts, and I've been honest with the population. I've told them there will be attempts to destabilize us. There will be protests that are funded by foreign interests. There will be media coverage claiming I'm a dictator. Don't be fooled. This is the cost of independence. Let me be honest about the risk I'm taking. I could die for this. Leaders who challenge Western interests in Africa often don't survive long. Thomas Sankara assassinated. Patrice Lumumba assassinated. Muammar Gaddafi killed in Western-backed uprising. The list is long. The pattern is clear. I know there are assassination plots. I know Western intelligence agencies have reached out to military officers asking about their concerns regarding my leadership. I know pharmaceutical companies have essentially put a price on my head, not literally, but through the massive resources they're dedicating to removing me from power. Every time I speak publicly, I know it might be the last time. Every time I make a bold move, I calculate the risk. Every day, I wonder if today is the day they make their move. But I'm doing it anyway, because someone has to, because Africa will never be free if every leader who tries to assert real independence gets killed or overthrown, and everyone else learns to stay in line. I have a wife, I have children, I want to see them grow up. I want to live a long life, but I want that life to mean something. I want my children to inherit an Africa that's truly independent, not just nominally sovereign while actually controlled by foreign powers. So I'm taking the gamble. I'm making the sacrifice that might be required, and I'm hoping that if they do kill me, enough groundwork has been laid that the movement continues without me. I've trained successors. I've documented everything. I've built institutions that can survive my death. I've ensured that if they take me out, someone else will continue this work. Because this is bigger than one person. This is about Africa's future. My declaration wasn't just for Burkina Faso. It was a message to every African country. You don't have to accept exploitation. You don't have to pay whatever prices pharmaceutical companies demand. You don't have to prioritize their profits over your people's lives. You can verify. You can negotiate. You can build alternatives. It's hard. It's expensive. It's dangerous. But it's possible. And if we succeed, you can follow. That's why we're documenting everything. That's why we're sharing our research. That's why we're building partnerships that include other African countries. Because one country achieving pharmaceutical independence is progress. 10 countries doing it is a movement. 30 countries doing it is a revolution. That's what the WHO fears. That's why they're silent. Because they know if this spreads, their entire model collapses. Imagine if 10 African countries implemented independent pharmaceutical verification. Imagine if those 10 countries coordinated their procurement to negotiate bulk pricing. Imagine if those 10 countries shared manufacturing capacity and technical expertise. The pharmaceutical industry's Africa strategy collapses immediately. They can't isolate 10 countries. They can't overthrow 10 governments. They can't maintain exploitative pricing across a coordinated bloc of countries that actually verify costs and negotiate collectively. That's the vision. That's the goal. Burkina Faso is just the first step. And I'm calling on African leaders. Join us. Yes, there will be pressure. Yes, there will be consequences. Yes, it's risky. But remaining dependent is riskier. Watching your people die while pharmaceutical companies profit is worse than any pressure the West can apply. Have courage. Build independence. Join the movement. Here's what we're doing over the next 12 months, and I'm sharing this publicly because transparency is our weapon. Month 1 to 3. Establish testing capacity. We're building the verification laboratories. Cuban scientists are leading the effort. Chinese equipment is being installed. Burkinabé scientists are being trained. By month 3, we'll have the capacity to independently test any vaccine or drug for safety, efficacy, and quality. Month 4 to 6. Complete cost analysis. We're expanding our analysis beyond vaccines to all pharmaceuticals. We're documenting exploitation across the entire health sector. We're publishing everything. By month 6, we'll have the most comprehensive documentation of pharmaceutical exploitation in Africa that's ever been assembled. Months 7 to 9, begin manufacturing. Our first manufacturing facility will be operational. We'll start with simple antibiotics and essential medicines. Not vaccines, yet those are more complex. But we'll be manufacturing something. We'll be proving that African pharmaceutical manufacturing is viable. Month 10 to 12, share the model. We're hosting a Pan-African Pharmaceutical Sovereignty Conference. We're inviting health ministers, pharmaceutical regulators, and medical professionals from across Africa. We're sharing everything we've learned. We're providing a roadmap for any country that wants to follow our path. This timeline is public. The WHO knows it. Pharmaceutical companies know it. Western governments know it. I'm not hiding our strategy because I want them to understand. We're not backing down. We're not waiting to see if they approve. We're building pharmaceutical independence, whether they like it or not. And if they want to stop us, they'll have to do it in full view of the world. No more quiet coups, no more mysterious assassinations. If they come for us, everyone will know why. While the WHO stays silent and Western governments apply pressure, something else is happening that matters more. Ordinary Africans are supporting this. Social media is flooded with pharmaceutical sovereignty hashtags. Young Africans are sharing our reports. Students are organizing rallies supporting pharmaceutical independence. A group of Ghanaian medical students organized a protest outside the WHO regional office in Accra. They carried signs, "Fair prices save lives and Africa deserves transparency," and support Traoré's demands. Nigerian activists created an online database where Nigerians can report the prices they pay for medicines. Within weeks, they had thousands of submissions documenting exploitation. South African researchers published an open letter signed by 200 African scientists supporting our position. They wrote, "Independent verification is basic science. Fair pricing is basic ethics. President Traoré is asking for both. We support him." This grassroots support matters more than any diplomatic backing, because when the West tries to isolate us, when pharmaceutical companies try to crush us, when the WHO tries to undermine us, they have to do it in front of millions of Africans who understand exactly what we're fighting for. Public opinion across Africa is shifting. People are asking questions. People are demanding accountability. People are recognizing that high medicine prices aren't inevitable. They're the result of exploitation. That's the revolution, not just government policy, popular consciousness. When millions of Africans understand pharmaceutical exploitation and demand change, no amount of pressure from Geneva or Washington can stop that. Let me tell you what pharmaceutical companies are really afraid of, because it's not just about African markets. They're afraid of the precedent. They're afraid of cost transparency. They're afraid of countries demanding to see actual manufacturing costs before paying for drugs. Because if African countries can see that a drug costs $1 to make and they're being charged $10, then European countries will ask, why are we paying $150 for the same drug? American patients will ask, why are we paying $300? The entire global pharmaceutical pricing structure is built on opacity, different prices in different markets, no transparency, no justification, just take it or leave it pricing. If Burkina Faso forces transparency in one market, it threatens opacity everywhere. That's why they're fighting so hard against us. Not because African markets are huge, they're not. Africa represents less than 3% of global pharmaceutical revenue. But because the precedent threatens the 97% of their business in other markets. A pharmaceutical executive was quoted anonymously saying, "If Burkina Faso succeeds in demanding cost disclosure and paying fair prices, every country in the world will ask for the same thing." We can't allow that precedent. This isn't about health policy. It's about protecting a business model built on information asymmetry and pricing power. And they're willing to destroy an African leader, destabilize an African country, and sacrifice African lives to protect that business model. That's what we're up against. That's why this matters. That's why the WHO is silent, because acknowledging our demands would threaten the entire system. Let me close by repeating the questions I asked that the WHO still hasn't answered. Question 1. Why do vaccines cost 5 to 10 times their manufacturing cost in African markets? Question 2. Why are WHO vaccine recommendations aligned with pharmaceutical company products rather than African disease burden data? Question 3. Why does the WHO accept funding from pharmaceutical companies while recommending their products? Question 4. Why are vaccines designed for Western disease patterns recommended for African populations where different strains are prevalent? Question 5. Why does the WHO oppose independent verification by African countries? Question 6. Why won't pharmaceutical companies accept fair pricing, cost plus reasonable profit margin? Question 7. Why are African countries charged more for vaccines than Western countries pay? Question 8. Why does the WHO prioritize expensive pharmaceutical interventions over cheaper, more effective public health interventions like clean water? Question 9. Why won't the WHO publish manufacturing costs for recommended vaccines? Question 10. Who does the WHO actually serve African health or pharmaceutical profits? 3 weeks of silence. Not one answer, not one justification, not one defense. The silence is the answer. They can't defend the system. They can only try to destroy those who question it. The WHO thinks their silence will make this go away. They think if they don't respond, if they don't legitimize my questions with answers, I'll eventually be isolated and removed. They're wrong. Because I'm not going away. This issue isn't going away. The evidence isn't going away. African countries pay exploitative prices for pharmaceuticals designed for Western disease patterns, while their people die from preventable diseases that could be eliminated with the money currently flowing to pharmaceutical company. Profits. That's not opinion. That's documented fact. And the WHO's silence is an admission that they have no defense. So let me make this clear. I will keep publishing data. I will keep demanding transparency. I will keep building alternative systems. I will keep calling on the WHO to justify their recommendations and their refusal to address pharmaceutical exploitation. And if they continue to stay silent, their silence will speak louder than any response ever could. My name is Ibrahim Traoré. I'm the president of Burkina Faso. I declared pharmaceutical independence, and the WHO's silence tells you everything you need to know about who they actually serve. It's not African health, it's pharmaceutical profits. And I'm done pretending otherwise. The revolution has started. The WHO can stay silent if they want, but silence won't stop what's coming. Africa is waking up. And no amount of silence from Geneva will put us back to sleep. This is not the end of the story. This is the beginning, and whatever happens to me, the movement continues. Because once you see the exploitation clearly, you can't unsee it. Once you understand how the system works, you can't accept it anymore. Once you know pharmaceutical independence is possible, you can't settle for dependence. The evidence is public. The model is documented. The path is clear. Other African countries are watching. They're calculating. They're preparing. And when they move, nothing the WHO says or doesn't say will stop the revolution. Africa's pharmaceutical independence is coming, whether they want it or not. Remember this moment. Remember the WHO's silence. Remember what it revealed about the system. And remember that change is possible when leaders have the courage to demand it. The revolution is here. Join us or get out of the way. Africa is taking control of its own health. Finally,